When you listen to a typical AI medicine conversation, there are usually so many opinions that surround this particular topic. But then if you look even more closely, you realize that we have two main groups. We have the first group, which is very optimistic about AI, talking about the good things AI is going to do to us, all the contributions it's going to make. And we have the next group on the other side, which is very pessimistic about AI, talking about how AI is going to replace all the doctors, how AI is going to, kill patients in the future, how it's going to misdiagnose, and all this kind of stuff. And the main question we need to ask ourselves is, who is telling the truth? Or should I say, what is the truth? Personally, I believe that a truth is not a single thing. I believe truth is what you believe it is based on the information that you have at a specific time point. That is what I think truth is. Because if you have a certain information at one time point, then you can say, okay, maybe that's your truth. And maybe you might find an information somewhere else later, and you might change your truth. So the truth keeps changing. It's not static. That is what I believe it is. So we need to actually go deeper into this topic and analyze what the facts are. What data do we have at this specific point, and what becomes our truth at this time point? That is exactly what this episode is going to cover. Hi, my name is Evans, I'm a medical engineer who loves to explore medical technology and go deep into AI and find out how AI is revolutionizing the medical space, or maybe not. Who knows? In this episode, we are going to discuss what AI is really not. We are going to see you draw a clear boundary between what AI actually is and what AI is not. And we know that AI also bases its truth based on information that it has at a specific time point. So we're going to see what the gold standard is, who sets this gold standard, and so on. And we'll move on to the next topic, which is going to be seeing what's automation bias is. So we have a term called automation bias. We're going to understand what automation bias is, and then we'll go to the next point, which is to understand who is liable when AI makes certain mistakes, or explore these particular topics. All right, so let us start off with the biggest misconception when it comes to AI in the medical space. When people think about AI in the medical space, they usually just think about some oracle, something that has the solution to all our problems. But in reality, this is not the case. AI is just a predictor, not something that uses logic to make decisions, just like a doctor would. So if you have a certain data, you train AI on a certain data, this AI is going to make decisions based on that specific data that you trained it on and nothing else. So if you have maybe a certain symptom, or maybe you have some symptoms of some diseases and you want to maybe ask a chatbot, okay, AI, Gemini, what is this symptom telling me about? AI is just going to give you a response based on the information that it has at that particular time point. And maybe that information is outdated, who knows? But then a real medical doctor will analyze the situation, use logic and new information to actually advise you on the particular disease or the particular diagnosis that you want to maybe get to. So seeing AI to be something that actually has a solution to all our problems is not entirely true. AI does not do that. It takes data that it has been trained on, analyze the patterns in this data, and then makes a prediction based on these patterns that has found out in this particular data. So it is not really giving you information based on facts. Facts when it comes to that particular data. But if there's any new information outside of that, then AI begins to shake and gives you wrong predictions in this case. So let's take a simple scenario over here, right? So you have a certain data that you use to train an AI model, and the data says lung cancer is associated with people owning lighters, or in other words, let me say, people who own lighters have lung cancer. If you have lighter and cancer, it doesn't necessarily mean that if you own a lighter, you typically have cancer. It means maybe if you have a lighter, you use that lighter to smoke, and then that leads to lung cancer. But AI just associates lung cancer with the lighter. And if you ask AI a follow-up question and say, okay, AI, how can I solve lung cancer? AI might tell you to take away all lighters. Just ban all lighters, and then cancer will be solved, because it has learned that people who have lighters should have cancer in the future. It doesn't necessarily use logic to determine that this lighter does not give you cancer directly, and that you have to use this lighter to smoke first in order for it to give you this lung cancer. So it's a really, really strange situation to really deal with. And I think that people should be more careful if they're dealing with AI. And where I think AI will be really, really suitable is that if it can be humble in a certain case. So let's say maybe if we are asking some questions outside of its data or a data that it's not been trained on, if AI can be able to tell us that, okay, this data or this information that you're looking for is outside what I already know, is not within my knowledge space, so I cannot really tell you anything about that. That would really be a great way to actually move forward if AI can be humble in this way. But unfortunately, we've not reached there yet, and we have a lot of hallucination problems going on with AI, and this is really, really insane. So let us assume that this hallucination problem has been solved. So AI is able to tell you that, yeah, this information that you want to know is outside my knowledge. I cannot be able to tell you. So maybe you look for other resources and maybe suggest some resources that you should look at to help you understand your problem that you are asking, or maybe the question that you're asking a lot better, right? Let's say we have this solved. It means we are relying solely on the gold standard data that this AI has been trained on. So the question we have to ask ourselves next is, where is this data coming from? Who is actually making this data? Who is making this data the gold standard? Because usually if you look at the data that has been trained by different models, or the data that is used to train different models, they are mostly created by a certain group of doctors who actually sat down and said, this is the gold standard. So in brain tumor segmentation, for example, if you have maybe some tumor around the brain and you want to maybe classify or segment this particular tumor automatically using maybe UNet or all of these machine learning models, I'm not going to go deep into it. You typically have a labeled data set from professionals, so professionally labeled data set. That is a group of doctors or professionals who sat down to actually label the part of the data set and said, okay, this particular is a glioblastoma tumor, this particular place or this tumor is this type of tumor, this tumor is this type of tumor. So this group of doctors sat down to give out this information. So how do we know that this is a gold standard, and what can we do about it if this gold standard changes? What I mean by that is, if we have new information, because medicine is evolving. Research that you have this week might be disproved the next week, and the information that you have today might not be true tomorrow. So the main issue here is updating AI with the latest information that we have. So you have to understand where the data is coming from and then update the AI based on this information. But we also have to consider another factor over here, that this information that we are updating the AI with can also be biased in a way, because we are humans, we make mistakes, definitely. And a group of doctors, or average group of doctors who are sitting down saying that this is the gold standard, can introduce some bias into the data that we use to train this AI, and this will in turn give us false predictions when we are later looking at the predictions that this AI is giving us. So it's not going to really match our expectations based on these small things like bias that has been introduced to this data by these doctors that give us the gold standard, right? So the main thing over here is actually to be a bit skeptical when you're using AI models. I'll just suggest you are very skeptical with it, and then double check everything you do, because that's also another problem that is actually happening, leading to the automation bias. So you see that at some point, maybe AI makes really good predictions. It gives you really good predictions, and then you begin to trust it blindly, right? So you stop using your own intuition, you stop using your own analytic skills, and you begin to trust AI blindly in this way, because that's giving you so much positive responses, or let's say maybe so much good responses, that you don't even think that it's going to give you a bad response at some point, right? But that is likely to happen. AI makes false predictions sometimes, and that is normal. No model is 100% accurate, and accuracy does not mean stability. It can be 100% accurate in some days or in some particular data set, and then if you introduce it to maybe a new situation where it doesn't have any idea about it, then it can be accurate, but then this accuracy will be wrong. So it's accurate in detecting the wrong things, if you know what I mean, or predicting the wrong things. That's how I like to put it. So automation bias is a really interesting thing that we need to check here. So we actually need to double check every time we use a model. We have to make sure we double check this information, and this doesn't only prevent us from receiving maybe negative feedback from AI, it also keeps us sharp in a way, because if doctors are always, trusting this AI blindly and not, double checking, maybe have a brain scan, they don't check this brain scan anymore to see if there's actually a tumor there, because AI said it's a tumor. Okay, they say we accept this treatment plan and we go with it. But then that shouldn't be the case because it numbs the doctors. It makes the doctors a lot weaker. We are creating like a next generation of weak doctors, basically. Doctors who are just like, checking check boxes or taking check boxes saying, okay, AI said this is true. Okay, we check the box. Okay, we have a prediction. Okay, this is good. Then, okay, we go on to treatment plan. AI said we should do it. So we check the box and all this. They're not using the critical skills anymore. And that is what is going to be dangerous if we keep proceeding in this direction. Right. Okay. So if you are skeptical, it's good. We can be able to, solve most of the problems that we have with false positives with AI if you are skeptical. But what happens if we trust AI blindly and then it gives us a certain prediction which in turn creates a bigger problem, like maybe killing a patient, for example, wrongly diagnosing the patient, and the patient just maybe lose part of its body or something. Let's say maybe on the brain, the AI predicts that we have a brain tumor over here at some point, and then they accept the treatment plan, they go into surgery, and then they cut that side off. And then the patient loses his speech or maybe his vision or something like that. Who is liable for this mistake that is done? Is it the person who created the software because maybe he didn't train it on good data to be able to predict the AI well? To be able to predict the particular situation or the brain tumor well? Or is it a doctor who actually just blindly trusted this AI and accepted the treatment? So that is a really interesting concept that we also need to think about, because it's not easy on both sides, right? I mean, if you look at it on a neutral ground, you can see that both sides are a bit at fault, right? So you can't really blame one person for this mistake that is happening. We just need to make sure that we create systems that actually keep these AI models in check. So yeah, what we understand from this podcast today is that AI is actually not something that uses logical information or logical knowledge, I should say, to make intelligent decisions. It just takes data, extracts patterns in this data, and then gives you a prediction based on the data that has been trained on. If you think about it in a critical way, you realize that the most important decisions that have to be made in order to make AI very useful in the medical space are all dependent on us humans. We have to make all the intelligent decisions. We have to make sure that we don't trust AI 100%. We also have to double check whenever we trust AI. 2, we have to know exactly where to use AI and where not to use AI. So a typical example of where to use AI would be to maybe automate some administrative tasks, like maybe renaming files or maybe just getting some patient information somewhere, but not important decisions like actually diagnosing the patient or having the final call on whether or not to accept a certain treatment plan when it comes to maybe treatment of cancer, for example. So we have to make all these vital decisions, and we also have to push forward in terms of research space to create explainable AI. When I talk about explainable AI, I mean AI that actually gives us a reason as to why it makes certain decisions. So that is explainable AI. To create a visual where we can see that, okay, this AI makes this decision based on this particular information. And that is the biggest problem that we have over here, because we see that AI is just like a black box. That's a black box problem, right? We see that we don't really see what the decisions are based on. We just see that it made a certain prediction, and we trust that it used the patterns in the data to make the decision, but we actually don't know a lot about these patterns that it used to make the decision. So this is very, very dangerous, right? So we have to be careful in this regard as well. So to understand everything, we can say that AI is just a super assistant. We just classify it as a super assistant, not something that will actually replace clinicians or something that will replace everybody in their jobs that they are doing, or something that will replace logical thinking in the type of way. It's just a tool to make our lives easier, and we have to use it as that. We have to keep the tools in the toolbox and then make humans the lead, or keep humans in the leading positions. Thank you for exploring with me today. I hope you learned something new. My name is Evans, and I explain.